Good morning. My name is Alia Grattan, and I will be speaking on image optimization today. Some of my objectives are to educate sonographers on ways to help optimize the ultrasound image. It may seem a little basic, however, these are the little things that we tend to overlook when we're scanning. So this PowerPoint is just a reminder on what we can do as sonographers to not only provide information to the ordering practitioners, but also to produce quality imaging for our patients. So we'll first talk about gain. The overall gain is a simple adjustment one can make to control the overall brightness or darkness of an image. And so we can also use time gain compensation, which compensates for tissue attenuation and adjusts over varying depth. So just a couple of images. It might not be a big contrast, but one's a little darker. So this one's darker than the other. And we want to just take time to look at our imaging and just make the best image we can. We have really good machines today, new equipment, and your images come out pretty well. But this is just to go over little things that we can do just to optimize a little better. And then with our TGCs, we just want to try to obtain a consistent brightness throughout the image. So the one on the left is very dark at the near field. And if you just adjust your TGCs to make it even all the way through, you just want to get that consistent brightness throughout the image. Dynamic range, which is also known as compression, and it refers to the ultrasound intensity. It allows for the adjustment of the range of grays. So the higher the dynamic range, the more grays you'll have, and then the lower the dynamic range, the more black and white, more contrast the image will be. So the image on the top, we have a high dynamic range of around 96, so you see how it's more gray. The one in the middle is more like 66, and it's a little more even with the black, white, and grays. And then the bottom image is at 42. Your dynamic range is set at 42. So we have a little more contrast, black and white. So when we're looking at our imaging and we're thinking about optimizing, we just want to be somewhere in the middle. We don't want it too grayed out, and we don't want it too contrasty black and white. Our focus, which is something we use all the time, we place the focal zone at the region of interest to obtain our best resolution that we can get. So here with the focus is set way at the top on the image in the left, and then you see how it's dark and then darker as we go down. When you're looking at the aorta, as in this picture, you want to put the focus right at the area of interest, and you get a better resolution throughout the image. And again, your image on the left, you see what you need to see, but the one on the right, it just gives a better image. You have your focus where it should be, and it's all about optimization. When using our wall filter, you want to make sure that you're not using too high of a wall filter to eliminate information. We use it to eliminate the high amplitude and low frequency Doppler signals. So here in this image, the one on the left, we have our wall filter set at 160, which is now it's eliminating the baseline Doppler, and then the one on the right, it shows you that it's a nice triphasic signal, where the one on the left, you have a monophasic signal. You have no Doppler on your baseline. So you just want to be careful. The one on the right is set at 70, the one on the left at 160. So just want to be careful not to use your wall filter and eliminate useful information. Then we talk about harmonics. With harmonic imaging, the signal returned by the tissue includes not only the transmitted fundamental frequency, but also signals of other frequencies, most notably the harmonic frequency, which is twice the fundamental frequency. Once this combined, the fundamental and harmonic signal is received, the ultrasound system separates out the two components and then processes the harmonic signal alone. And then your harmonics can improve your lateral resolution. So here, the one on the left, again, both of these images are acceptable, but when you're talking about optimizing, the one on the left, you don't have your harmonics on, so it just looks a little more, not as smooth, not as clean, and when you look at the one on the right, you bring out your near and far walls of your intima, and it just shows the image a little better. Your depth improves your temporal resolution when the structure being imaged is at a decreased depth. The more depth you have, the slower the frame rate, and the worse the temporal resolution becomes. So pulses will travel at shorter distances when depth of penetration is reduced. So here's an image of an aorta in transverse, and the image on the left shows that there's too much depth and you get the spine. So if you were to submit this to your physician, they might look at that and say, oh my goodness. Or anybody outside looking at this might think it is a mass or something to that effect, and you're getting unnecessary information in your image. The one on the right, if you were to change your depth, bring your image into the center of the screen, it shows much better. It shows what you're looking for. You don't have all this useless information. You want to get the smallest depth of field to image your area of interest, and then a larger depth of field for deeper structures. So what can we do to optimize this image? So this is an image of a vertebra. I know today a lot of the equipment has where you can do the auto angle, and what you want to do is you want to learn how to start heel toeing. I know a lot of people have gotten away from heel toeing your vessel to get an angle on your vessel, and then you'll get a nice angle instead of just trying to do the auto angle and just let it lay anywhere it is. So that's one thing you can do to optimize. And then also what you could do here is you could change your scale. So the scale's set at 160, but your PSV is at 86. So it only takes a moment to just decrease your scale just to get a better image. So we know that today equipment is very advanced. Machines are equipped with B-Flow, iScan, presets, Scan Assist, just to name a few. So sonographers, we don't have to do much when it comes to optimizing. However, every patient is different, and how one preset works for one person, it might not work for the next. So at your equipment in your facility, you might have presets set up, carotids, venous, abdominal presets, and then you turn that preset on, you scan your patient, and you don't change anything throughout the entire exam. But you can't do that for every patient. So it's set up to help you get started, but we still need to do some optimization throughout the study. That's why it's important to take a moment and just adjust a few things to make the image that much better. So here's a couple of examples. So we have the right, in the image one, we have the right internal jugular vein. It's taken using an established preset without any optimization. So on this patient, that doesn't work. So we optimize by decreasing the depth, increasing the gain, and we increase the speckle reduction from 3 to 4. That helps reduce reverberation artifacts. On this image, image one's taken with just using the established preset for upper extremity venous. So it has the information that the physician would need, but image two, if you just take a moment to decrease your depth, decrease the Doppler scale, and adjust your baseline, you have a better optimized image. So again, it's important to remember to make the adjustments needed to provide quality images. If we were all to just go look in our database or our PACS system where we store our imaging and you just randomly pull out some cases, you'll see that there's certain things that we could have done to just make the image that much more better than just using our basic presets, taking the image and sending it through. So because the equipment, again, today we use is so advanced and it produces such good images, we sometimes forget just to make those minor adjustments we need to produce better images. Thank you.